Welcome back to I Care for Your Brain with board-certified neuropsychologist Dr. Karen Sullivan. Remember, no more edits. I am going to keep rolling even if I lose my train of thought or I can't find my words, because you know why? I'm human and so are you. This is my Gabapentin story. My Gabapentin video is my most viral video with 1.5 million views. And I didn't know if I would ever have an occasion to actually take Gabapentin. Well, turns out this summer I did. I want to know if my experience, especially as I went up in the milligrams, matches up with your experience at all. So why did I have to take it? Well, on my birthday this July, I was at the beach enjoying a nice week off with my family when my left shoulder started to hurt. And I thought at first maybe I had slept on it wrong, but the next day I was slapping some sunscreen on there and felt some bumps and thought, okay, well, what the heck is this? We were at a rental, and so my very first thought was actually terrifying. I thought I had bed bugs. That was the very first thing I thought. So anything after you realize it's not bed bugs is going to be okay. I sent a picture of my back to my nurse friend, and she said, no, honey, this is shingles, 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 shingles. So I had to find an urgent care, and the key is you want to get on the antivirals ASAP. And you want to nip the nerve pain that can come from shingles in the bud as much as possible. So that's exactly what I set out to do. Shingles pain is nerve pain, which is burny, kind of sharp. There you go, my light fell. That's the very first blip that happened. We'll just roll with it. Sharp burning pain exactly where the rash is, and then on the inflamed nerve root. So shingles is, you've had chicken pox and it lies dormant in your nerve roots in your spine until you have an extreme stressor or your immune system goes through something, and then it reactivates in a specific nerve. So that was very interesting to learn, because basically it just goes along one dermatome. So once you figure out where in your spine it's coming from, you can kind of track where you're going to have the pain and the rash. So my pain, I would say, was not mild, but not severe. Definitely interfered with my sleep in the beginning. And then anytime anytime I raise my arm or like fabric would go up against the rash, that would really hurt. So found an urgent care, and they gave me the antivirals, the gabapentin, and topical lidocaine patches. Now, I never used the topical patches, but I did want to take the gabapentin because about 20% of people develop something called post-herpetic neuralgia, where it's basically a chronic pain syndrome because that nerve is just angry and inflamed. And so I have heard about that from patients, and I was like, no. I want to do everything I can to try to calm that nerve down. So that's what I did. And the idea is the gabapentin is calming overactive nerve signaling. So first few days I was on 300 milligrams, and honestly, felt good, like sleeping better. The pain with shingles tends to get worse at night. And also I was at the beach, so I couldn't help but get some sun on it. So maybe a little exacerbated by sunburn. But really nothing weird. Not even sure, I did sleep better. But nothing really startling. Certainly no side effects. But when I got home, the pain definitely got worse. And for just 2 nights, I took 2 of the 300. So I was up to 600. The doctor at the urgent care said, now you can go up to 3,600. Now, some people describe shingles pain as worse than childbirth. I would not say that was my experience, but it was definitely at night like a 6 or a 7. And like all people, I need my sleep. During the day, I would say it was definitely like a 4 or a 5. So after the few days of taking the 600, I would say I had pretty significant cognitive symptoms. So definitely for me was my internal language was the big change. So really trouble putting concepts together internally, but also when I looked at some of the emails that I was sending around those times, oh my God, definitely a little disorganized, a little disconnected, things kind of, repeating words every now and then. I often tell patients, well, what the literature says is anything over 900 of the gabapentin a day is when we would expect the beginning of cognitive symptoms. This was not my experience at all. I would say the personal and professional communication challenges were really hard, actually, and only lasted a few days. So it gave me a lot of empathy for how many people out there struggle, not just with chronic pain, which is a form of internal distraction, but then also cognitive side effects from the very medication that are there to help the pain. I definitely felt less like myself. I felt frustrated. I would say something and I'd know it was wrong, but it was like my thoughts and my brain kind of weren't synced up on the same timeline. And that made me feel less confident, and it was harder for me to explain things. And I actually felt for a few days like very irritable because I was just like, I wasn't in sync, my mind and my mouth. I definitely felt that I could not continue my life at the 600. Now, granted, I think it's because my pain was kind of moderate. Who knows how I would have felt if I actually needed that, or even if I needed to go up to the 3,600, which, you take over 3 times a day because the half-life of gabapentin is basically 6 hours. So the case studies show very similar experience to what I'm telling you. So yes, it did seem to help the pain, but also the cognitive side effects are so severe that people stop taking it. And that's exactly what I did. I just felt like I could not live my life at the 600 dose. Now, I know a lot of you are listening to me like, girl, I take like 1,800, 2,800, 3,600. I don't know how you do it. I literally do not know how you do it. And I know if you're up that high, it's because you've kind of decided to shift one type of suffering for another, right? Because, okay, I need to take it. I mean, I think it's got to whack most people out of their minds, but if you're in so much pain, what choice do you really have? So I just felt like, for me, I just stopped it completely. I had only taken 600 for 2 days, so I didn't feel like I needed to taper. I've never gone back to the 300 just because the pain really wasn't that significant. So that's my experience. I don't know how y'all are doing it out there over 600. Also, a good reminder to get your shingles shot, over 90% effective at preventing shingles and that post-neuralgia pain syndrome I talked about. Since 2017, the CDC recommends everyone over 50 get it. Now, it had not been recommended to me, but who's to say I would have taken it? Because I do think about it, or I did think about it, as something that affects people like over 60, 65. But, if you've got enough of the predisposing factors for your immune system and your stress level to kind of go hairy-carry, good chance you could get shingles. I definitely would not want to have it again. I felt very grateful. Mine was relatively moderate. Felt very grateful it wasn't on my face, and especially in my eye. If you have tried gabapentin over the 300, I want to hear you. What are your experiences like? Did you think it helped? Did you have these same cognitive side effects as me? What was your experience? Let's share in the comments and get a community going about this. Thanks so much. Talk to you later. Bye.